Antimicrobial resistance, AMR, is now a global public health crisis affecting human health with preventable deaths, high local healthcare costs, and longer hospitalization as some of its consequences. Deaths attributable to AMR every year compared to other major causes of death paints a gloomy future, with figures at 10 million deaths by 2050, costing £66 trillion if action is not taken now. Unfortunately, investment into the production of new antibiotics is not encouraging. Yet, the continuous increase in infection comes with increase in drug resistance to antibiotics. More often, research into AMR is concentrated on health facilities to the neglect of other areas such as the home environment, a situation that affects policymakers at both the local, regional, and national levels, as huge sums of money are pumped into seeking the well-being of its citizens. In Ghana, the status quo remains the same, with statistics suggesting that most transmittable pathogens are failing to respond to common, potent, and easily accessible antibiotics in most health facilities, affecting productivity and the national purse. Reasons being, huge sums of monies projected for development goals end up procuring medicines for the health sector. In 2019, University of Ghana's Noguchi Memorial Institute of Medical Research and Lancaster University UK, in partnership with HATOF Foundation, an environmental and sanitation NGO, came up with the Dust Bunny project, which looked at home cleaning regimes in the country with a specific aim to develop an understanding of the home as a potential source of infection from AMR bacteria carried by dust by exploring hygiene practice across different household environments.
Those dust particles that usually we find in our rooms, sometimes you see them like webs collected underneath places that have not been swept. It's a very critical message in that those things that we see as just dust can be killers to us, very destructive. Because there's this thing I learned from the workshop. Realize there's a connection, or if you like, you may call it a web, between the dust, humans, even the meat we eat. So there was this picture of people taking antibiotics, which is supposed to deal with the bacteria as a result of the dust causing it. These people now developing resistance and thereby introducing the same material into the environment, into our water, into our animals. And so in a way, it is circulating among us. Could be in that cycle, and that's why I'm calling it a web. And that shows the complex nature of this.
The bigger picture for this project is to reduce bacterial infection in the household environment in order to reduce AMR and also to convey awareness across the country. The project was carried out in some urban and peri-urban communities in the national capital Accra, where an approximately 250 households were used. The Dust Bunny Master Plan is aligned to achieve the United Nations Sustainable Development Goal 3, which seeks to ensure healthy lives and promote well-being for all at all ages.
So what we found was that these are in the home, and they are a threat. They're a threat to people who maybe have HIV, who are immunocompromised, maybe have diabetes, or generally their immune system is stressed. And the bacteria we found the resistances in were not the really bad, what we call pathogens or bad bacteria. They were in bacteria which we class as opportunist. So they're the ones that can make you ill when your stress levels are up or your immune system is compromised. So what we showed is that there is a risk, and by good cleaning and healthy cleaning regimes, you can reduce that risk.
Whilst people think that it is enough or it is okay to just walk into a health facility to go and buy antibiotics, I think the findings of this work has really revealed to them that it is not the best approach for you to prescribe medication for yourselves.
The project combined design research with environmental microbiology to address the issue and co-designed sustainable cleaning interventions for various aspects of healthy life and lifestyle.
But also we found other things that we didn't expect, like for instance the importance of involving communities in the design of preventive interventions. So it's not just the science that is driving, it's important to work with the communities, with the recipients of the intervention, and design with them whatever intervention. Because this helps not only in terms of acceptability, so something that people will take in their homes and they will use as a regime, but also, as we've seen, they will spread the word to the family members, to other households, to the wider community.
The October 2023 engagement drew participation from policymakers and collaborators for an Impact Accelerator session. It is themed Making the Dust Fly, creating 1 million+ conversations in Ghana on home cleaning and superbugs. This ends the phase 1 of the project and sets the next in motion.
But it's a very, very complex story, of which this is just one component. Cleaning the home, cleaning the surfaces, proper prescription of antibiotics, a healthy lifestyle are all the contributing factors to make antibiotic resistance start to reduce.
From the microbiological data analysis, 11 bacterial species were identified, and among them, the 481 isolate collected, 36.6% hosted at least one resistance to the initial panel of antibiotics tested.
The hoovers would not spread the bacteria as the brooms done, where they tend to capture a lot of the dust and other particles. The hoover tends to suck it up inside. But it's still important every so on to clean the surface of the hoover. And also when you empty the hoover, and what I'm also doing at my home is do it outside, not inside the home, because the moment you open it, you may spread some of the collected dust or particles.
School pupils are said to be the change makers, and so their facilitators were well represented.
So we are to create the awareness that once you are cleaning, materials that you are using to clean should be specific to a particular object. Cleaning materials such as brooms also should be room specific. If they are meant for the bathrooms, they cannot be transferred to the kitchens and the rest. When we do this, the spread of diseases are also being controlled. Now, it's basically about bacteria. The treatment of these bacteria has to do with antibiotics. These bacteria are now growing resistance to the antibiotics. One way by which these things are growing in our country is because of the misuse of these antibiotics. Self-medication should be completely out of the norm. Now, in order to ensure that humans are safe in our country here, by eradicating the spread of diseases through bacterial infection, we have to do the right cleaning. Dust Bunny project is to sensitize the population as to how to do the right cleaning. Our children are going to be the agents to be used. So we are going back right to the schools, sensitize, create the awareness in these children that once we do it in our homes, we are saving the nation.
And this project is here to help us reduce the effect of this, if not eradicate it. And so the channel or the idea is to channel it through the schools, so that there will be a kind of behavior change, and thereby, in a way, solving the crisis that we find ourselves in. When I get home, I would like to speak to my family about, especially where we use mops or brooms that we use in our rooms wouldn't be used in the washroom or used out there. Because I've learned that this is what causes it, and that it will introduce a whole lot of mess even in our lives.
UK's Arts and Humanities Research Council sponsored the project. With this baseline information gathered, what next?
We've still got more data to analyse, because we're going to look at the difference between before the cleaning regime changed and after the cleaning regime changed. So what we have is the kind of baseline data now, so we can make that comparison, which we're doing at the moment.
Experts say stronger implementation of evidence-based strategies will improve the health of households, reduce healthcare spending on cold and associated symptoms such as cough, catarrh, and headaches, among others.
Even in the Bible, God encouraged us to be very decent, to be very clean, as He instructed the children of Israel in that even when they go to toilets, they should wash their hands. So as people, if we want to live long and reduce the medical burden that we have on ourselves and on our economy, it is important that we pick up the issue of hygiene, sanitation, and cleanliness as second to none, as people who wanted to improve our livelihood.
They say the surest way of reducing risk of AMR and saving policymakers from making economic losses and keeping a productive workforce is improving upon local practices such as cleaning and sweeping within the household, as well as other environmental factors. The Dust Bunny project, carried out over a 2-year period, looked at developing home cleaning interventions through community engagement to reduce infections and antimicrobial resistance (AMR) in Ghanaian homes.